Hi, my name is Kia Tills and I welcome you to listen and watch my presentation, which reflects over the duration of my degree so far and the process to creating my personal nursing philosophy and setting a goal for my career. Firstly, what is a nursing philosophy? A statement that summarises a nurse's principles, ethics and beliefs, as well as their reasons for entering the profession. This is referred to as their nursing philosophy. There are 4 elements that make up a nursing philosophy, and they are knowledge, values, roles, and processes. These elements serve a construct for developing goals and outcomes. In research from Lapine 2011, the beliefs were putting the patient first, providing holistic treatment, maintaining a high professional level of care, calibrating with doctors, making a difference, humanizing the experience, and being driven by motivation. By outlining and clarifying their core principles, the participants were able to create a philosophy that they all could agree on. Through the process of reflection, I have found that there are multiple reasons why I want to become a nurse. Being a nurse combines academics and practice. As a nurse, you get to aid and work with others. Finally, it's thrilling, frantic, and difficult at times, which creates a great challenge. To unpack that further, combining academics and practice, the profession of nursing is one of very few that combines a high level of practical work with a deep scientific intellectual foundation. I find that nursing offers the options more than any other career. I appreciate the chance to put academic knowledge to use in a practical situation. Moving on to aiding others, I really believe that the most fulfilling thing a person can accomplish with their life is to help others. Nursing provides the opportunity to actively assist others in a hands-on atmosphere, where you can actually improve people's experiences during what may otherwise be a difficult moment for them. This belief has been supported by my professional experience since I have seen firsthand the influence that nurses can have and the level of resilience that is necessary for them to do so. I am aware of my resiliency and the roles is suitable for me. In addition to helping others, as a nurse, you also get to work with others. I've always appreciated working with others. I gain a lot of energy from working in teams and using our collective knowledge or expertise to complete tasks more effectively. I enjoy conversing with others and helping them get through their issues or trying circumstances. It is therefore a fantastic fit for me to have the opportunity to directly assist others while collaborating with individuals who have a variety of skill sets. Finally, my favorite part of nursing is it's thrilling, frantic, and difficult. I think that working in nursing offers a demanding and interesting job that you won't find elsewhere. The perseverance and drive that nurses have followed have absolutely astounded me throughout my professional placement experience. I discovered that I would remain later than usual every day in order to see more aspects of patient care or follow up with nurses on patients. Over the past 2 years at university, I have realized that a nurse is a very challenging role. There are new discoveries of what is best practice, and this is combined with methods that have been used for many years. With this combination, it creates a perfect recipe for the best patient-centered care. For my personal nursing philosophy statement, I believe that I should strive to demonstrate integrity, perseverance, and compassion. By combining those qualities with a desire for continuous improvement and the ability to learn, as well as the willingness to advocate for those that cannot advocate for themselves, I can enhance the process from illness to treatment to recovery for my patients and their loved ones, while also growing as a professional. As a future nurse, I believe that it is my duty to cultivate a culture of lifelong learning and sees any chance to master skills that will help my patients. Being a nurse is one of the most selfless careers a person can have. I want to give this endeavour everything I've got in hopes of changing the lives of others. My approach to nursing is that it's not just a job. I'll make an effort to be motivated about using my skills and expertise to help others who can't help themselves, and I'll see it as a responsibility to do so. I promise to work as hard as I can to improve the lives of people throughout my career as a nurse. Moving forward, we are going to look at what and who has influenced my practice. For me, there is not one individual person or particular event that has influenced my practice as a student nurse. There are many, from my father's cancer scare to recently giving birth to my baby boy, and the works of incredible women like Florence Nightingale, Mary Breckinridge, and Clara Barton. Now, my dad's cancer scare. In short, my dad experienced a very sudden diagnosis of stage 4 cancer, which after a major surgery turned out to be a football-sized tumour that had taken over his kidney. This was a huge shock to our family, and we really struggled with it. The care and compassion throughout Dad's hospital stay was outstanding, not only for Dad, but also for my mother, brother, and myself. They explained and reassured every time we needed it. My dad is from the country and very awkward towards getting cared for, and the nurses acknowledged that and really went to the next level to make him comfortable by getting to know what he is comfortable with and what he was not. My most recent experience over Christmas was giving birth to my baby boy. I've never been a patient in hospital before, therefore never experienced hospital care firsthand. This really showed me how important it is to support your patients, as it is scary to be in hospital. Many things are unknown, and for a lot of people, a completely new experience. I felt worried to ask questions or request things, as I did not want to bother the nurses as they seemed very busy. I hope to give my patients the perception that at any time they can ask for anything, and within reason, I will endeavour to assist them. Now, to dive further into 3 amazing nurses. Firstly, Florence Nightingale. As per research by Dumitrisu et al. 2020, Florence created and put into effect action plans to enhance hygienic conditions and made mandatory hand washing, bathing, and other infection control concepts. She used similar methods during the Crimean War, which resulted in a 2/3 decrease in the hospital's death rate. Some of these practices are still used today. Moving on to Mary Breckinridge, the Frontier Nursing Service, FNS, which offered complete family medical care to mountain residents of rural Kentucky, was founded by Mary, according to Risch in 1992. FNS provided service to disadvantaged and rural regions that were still accessible by horseback. She attempted to professionalize nurse midwives so they could practice independently in homes and dispatched clinics. In research from Remedy Apple 2010, they advised Breckinridge's work showed effectiveness by significantly lowering newborn and mother mortality in Appalachia at a relatively low cost. Finally, Clara Barton. As advised by Thomas Schittel 2020, Barton risked her life during the Civil War to assist and provide supplies to soldiers serving on the front lines. At the age of 59, as per an article by Mundy and Donnell, Clara formed the American Red Cross and served as its president for 23 years. Her life was guided by her awareness of the ways she might assist those who were in need. Each of these people contributed something novel, if not outright revolutionary, to their field, and as a result had an influence on nursing science. Now touching base on placement. Placement really showed me the importance of care that is centered on the patient. Spending time talking, listening, and spending time with patients helped me develop a better understanding of their capabilities and healthcare requirements. It also helped me develop a rapport with them and helped me deliver patient-centered care. Additionally, treating everyone with respect. One of the most important things I took away from my clinical placement was the value of providing patient-centered care, communicating with respect and treating people with kindness and dignity, just as I would treat a member of my family or how I would want to be treated if I was receiving care. Furthermore, another interesting experience during placement was getting the chance to tackle difficult situations. As an example, working with patients who have mental health conditions like delirium or dementia, where disorientation and violence may be present. This exposed me to situations that were psychologically and/or physically taxing. I discovered the value and importance of getting advice from my clinical partner and learning to read patient body language in order to maintain patient safety when dealing with aggressive and violent patients, where some behaviours may be brought on by misunderstanding, pain, urination, hunger or thirst. The goal I wish to apply in my first year of practice as a registered nurse and during placement is that I will be extremely careful while speaking with the patient and family to avoid using any medical jargon, and I'll ensure that they comprehend what I've said by having them repeat it after me. At the conclusion of each talk, I will also invite their questions. When the patient can accurately recite the issues and treatment plan that have been described in his or her own words, the objective has been met. My philosophy will assist me when achieving this goal, as it is focused on communication, person-centered care, and the continuation of learning. Thank you for listening to my presentation. I hope you enjoyed it.